NHIS in a week, where we give you the happenings and highlights of the authority and the scheme. My name is Shanice Pound. Now the headlines. NHIA Membership and Regional Operations Directorates holds 2024 Mid-Year Performance Review Meeting. Police Hospital seeks NHIA support. NHS Consortium and NHIA join forces to strengthen Ghana's healthcare system. Now to our first story. CPC Cape Coast held its mid-year performance review meeting, where staff and management gathered to evaluate the officers' performance for the first half of the year. Senior Manager Mr. John Awuku Ahevi delivered a detailed report highlighting key achievements and areas for improvement. The meeting featured in-house training, including presentations by Mr. Benjamin Apiakubi on claims vetting accuracy and Mr. Ebenezer Bote on ICT updates. A special highlight was the recognition of Mr. Frederick and Ms. Patricia Ente for their outstanding performance. The meeting concluded with a collaborative discussion reaffirming CPC's dedication to excellence and teamwork. The NHIA has launched a 3-week capacity building training for its data analytics unit, starting on August 26, 2024. This initiative, in collaboration with Farm Access and the Ghana-India Kofi Annan Center of Excellence in ICT, aims to enhance data-driven decision-making to improve healthcare delivery in Ghana. Deputy Chief Executive of Operations, Mrs. Louisa Tajiman, emphasized the importance of using data to drive healthcare excellence.
The importance of data analytics cannot be overstated. The use of data-driven insights is crucial for making informed decisions, optimizing resources, and ultimately delivering high-quality healthcare of Ghanaians. This training is an opportunity for us to equip our data analytics unit with the necessary skills and knowledge to leverage data more effectively. By building our capacity, we are not only improving our internal processes, but also setting the stage for a healthcare system that is more transparent, accountable, and patient-centered.
Farm Access Country Director, Dr. Maxwell Enchi, urged a shift from simple data analysis to actionable insights.
Give executive management options for the data for us, don't give them by chance. If you forget everything that I've said, please remember that. They will not be able to use by chance and by chance. Give them options based on what we are seeing. This is the reason. If the trend continues for the next 20 years, this will be the picture. Based on this, these are the options A, B, C. Then you go to a management meeting and look at the options, which ones will be feasible.
Participants are expected to play a pivotal role in advancing the NHI's efficiency and healthcare outcomes. Ankafo Psychiatric Hospital has organized the mental health screening for the staff of CPC Cape Coast as part of efforts to promote workplace well-being. Led by Dr. Makafi Akukluche and a dedicated medical team, the screening followed a previous health-related sensitization session. Staff from various departments were educated on completing medical assessment forms and participated in private consultations to address their mental health concerns. For those in need of further care, immediate treatment, including prescribed medications, was provided. The initiative underscores CPC's Cape Coast commitment to prioritizing both mental and physical health for its employees. The NHIA has urged regional and district management teams to strictly comply with the Government Integrated Financial Management Information System (GIFMIS) application law. Speaking at the NHIS 2024 mid-year performance review meeting in Kumasi, Deputy Director of Finance, Mr. George Asamaba, emphasized that all financial transactions must be processed through GIFMIS, warning that non-compliance could lead to sanctions under the Public Financial Management Act. In a recent visit to the National Health Insurance Authority head office, a delegation from the police hospital met with Mr. Frederick Gilbert Addy, NHI's Deputy Chief Executive for Finance and Investment, to discuss the hospital's growing financial challenges.
The delegation detailed the rising cost of key services, including costly mass burials, outpatient care for police personnel and their families, and treatment for unidentified patients. A pressing concern was the significant expense of providing dialysis treatments, which has placed a considerable strain on the hospital's budget.
We also have to talk about the issues of dialysis. We take our police personnel at dialysis on you. They come for sessions, 3 sessions every week, and then in the year we are talking about 52 people for only police personnel and their dependents. The statistics for the civilian batch is around 120 people within the year, and then we are talking about 3 sessions of search within the year. Police personnel are having these sessions for free, and then we have to buy the reagents and then take care of them for free. On that B2, we've also come to play on NHIS to assist us in that regard.
Mr. Addy assured the delegation that the NHIS will thoroughly review their request for financial assistance. He noted that an upcoming meeting involving the NHIS Finance Directorate, Chief Executive, and the board will explore potential solutions to ease the hospital's financial burden. Both parties are committed to working together to ensure the continued delivery of essential healthcare services at the police hospital.
So right from here, you have to go and see my boss, because our board channel will be today. Generally, we are going to meet him. So you have to also go and explain this. For me, I'm impressed with this.
The authority has introduced new membership tools aimed at improving the efficiency of its operations. On September 3, 2024, a one-day training session was held at the NHI Western Regional Conference Room to familiarize staff with a new integrated membership solution. Acting Regional Director Mr. Kwame Natechi Arthur emphasized the NHI's commitment to innovation, focusing on the transition from booklet receipts to e-receipts and now the new membership tools, NMT. The training covered key features including social status endorsement, Ghana card integration, and cashless payments. The initiative is expected to streamline membership registration and enhance the overall NHIS experience. The Deputy Chief Executive of the National Health Insurance Authority, Mrs. Louisa Tajiman, has urged regional management teams to intensify efforts to meet the 2024 target of 20.8 million active members. Speaking at the NHIS Mid-Year Performance Review meeting in Kumasi, Mrs. Otajiman praised the progress made, including the success of the My NHIS app and improvements in claims management, which have enhanced operational efficiency. However, she acknowledged challenges such as funding delays and logistical issues. The meeting also highlighted exceptional performances by the Bono and Bono East regions, setting a positive tone for the second half of the year. To our final story, the UK's NHS Consortium for Global Health and Ghana's National Health Insurance Authority held a key meeting in London to enhance collaboration and strengthen Ghana's healthcare system. Led by NHS Consortium's Kevin Miles and NHIS CEO Dr. Da Costa Abuaje, the meeting focused on sharing expertise in strategic financing, capacity building, and data analytics. Discussions centered on improving tariff generation, resource allocation, and provider payment systems within Ghana's National Health Insurance Scheme, alongside strengthening data governance and analytics capacities. This collaboration builds on prior engagements, including a study tour in 2023 and a visit to Accra in 2024. The NHS Consortium will help develop funding formulas and indicators to track health checks, expand preventive services, and provide training in data analytics. Up next is Preventive Health segment.
Preventing malaria, key tips. Malaria is a serious and sometimes fatal disease transmitted by mosquitoes. Here are some effective strategies to protect yourself and your family. Sleep under mosquito nets. Use insecticide-treated bed nets to cover sleeping areas, providing a physical barrier against mosquitoes. Wear protective clothing. Dress in long sleeves, long pants, and socks, especially during the evening time and night when mosquitoes are most active. Eliminate standing water. Mosquitoes breed in stagnant water. Regularly empty covers or treat containers that hold water, such as flower pots, rain barrels, and old ties. Use insecticides. Spray indoor insecticides or use mosquito coils and vaporizers to reduce the mosquito population inside your home. Take anti-malaria medication. If you live or travel to a malaria endemic area, consult your doctor about taking anti-malaria drugs as a preventive measure. Stay informed. Keep updated with local health centers on malaria outbreaks and preventive strategies. By following these steps, you can significantly reduce the risks of malaria and protect your health. Stay vigilant, proactive in your efforts to prevent this disease.
Hey, what's up?
How far with your internship?
To be honest, I'm so nervous about starting this new role on Monday.
Oh, please. I know you'll be great at it. You should be worried about what benefits they have. Example, do they have health insurance?
I doubt they will have that for interns. But no shaking. I have NHIS already.
After you on a line, ting.
Hey now, look at you. What are you going to do in the office when you can just download the app to register for an NHIS membership?
Yes, my people. You heard right. You can now download and register your membership on my NHIS app. No long queues or tedious paperwork. All you need is your Ghana card to register for yourself and for others. Once you register, you get a new digital NHIS card on your phone. My NHIS app gives you access to credentialed health facilities and services across the country. NHIS covers over 95% of disease conditions in Ghana. Access to healthcare just got easier.
Now let me sign up quickly. Miss Steph, I'm starting work next month.
That's all that we have for you in this week's edition of NHIS in a Week. For more information, visit our website at www.nhis.gov.gh or visit our various social media handles displayed on the screen. My name is Shanice Palm. Do have a lovely week.